An emergency summit of about 40 health worker groups has heard the level of burnout has reached the point where it's starting to threaten the sustainability of the healthcare system. The summit, co-hosted by the Canadian Medical Association and the Canadian Nurses Association, says that healthcare systems need some drastic intervention from both federal and provincial governments if there is any hope of reviving them. Health organizations seem to agree with the provinces that more long-term funding is needed, but CMA President Katharine says what's needed is radical change and for the federal government to take on a greater role. Well, to tell us more about the current state of Canada's healthcare workforce is Dr. Katharine Smart herself. Doctor, welcome to Forum Daily.
Thanks for having me.
So after 2 years of this pandemic, what does year 3 look like for Canadian healthcare settings?
I think it's really worrisome. Even though the number of cases of COVID are starting to decline in hospitals are still over capacity. Many Canadians were unable to access the healthcare they needed during the pandemic. Many chronic diseases worsened, and we're still hearing from colleagues on the front lines that hospitals are full. And we haven't even talked yet about the surgical backlogs that need to be addressed. So there's a lot of pressure still on the system.
Some concerning developments there, ma'am. Now, last week's summit was attended by 40 healthcare worker groups. So what was the underlying message that these groups were sending when it comes to their workers?
Dramatic burnout increasing since before the pandemic across all health professions. It was a common experience, and deep concern for the lack of planning when it comes to human health resources across the country. So I think the message was really very much the same from everyone that was in attendance.
And you mentioned that radical change is needed here. So what would this radical change look like?
I think it would surprise Canadians to know that there is no human health resource plan for our country. So even though healthcare is one of our biggest expenditures, no one's really looked at what is needed to staff the system. How do we meet the increasing complex needs of Canadians? So when we're talking about radical change, we're talking about actually stepping back, politicians admitting there's a problem, admitting the system's collapsing, that human health resources are critical to delivering healthcare, and then committing to work with healthcare professionals around what does that actual system need to look like to create sustainability and to create a plan moving forward.
And you're saying that the federal government needs to take on a greater role in this issue. So what kind of steps can these federal officials do in terms of assisting this issue?
I think we need federal leadership to make sure that dollars are going where they're needed and to actually be able to take a national lens to what's happening in this country. Having every province and territory siloed, not looking at the human health resource crisis in particular from that broader national perspective, really limits what we can do and the changes that can be implemented. So we believe strongly there's a leadership role for the federal government to help us right the ship.
And what about provincial governments, Dr. Smart? What kind of unique contributions could they make in their own healthcare systems?
Provincial governments, of course, are primarily responsible for delivering care. So we think they need to come to the table with healthcare professionals and hear what we're trying to say about where the system's failing. I think one of the best examples can be in primary care. The old-fashioned siloed model of running primary care like a business is failing. That's why physicians are not choosing to go into primary care. And there's a huge opportunity for the provincial level of government to work with primary care providers to look at how integrated team-based care can become an actual reality for the Canadians that rely on it.
So from our conversation, it's clear that mental health within the healthcare setting is only getting worse throughout this pandemic. So what's at risk here, Dr. Smart, if steps are not taken to address this worker burnout?
Well, what we're already seeing is large attrition from healthcare for people that haven't left the system. We're hearing that they're considering leaving the system. Almost 50% of physicians are considering cutting back their work hours over the next 2 years. So if something's not done, we are going to have a dramatic access to care issue. And there's only going to be more Canadians either unable to access care or on these very long wait lists. So it's really the time for action has long passed. We need to get on with actually solving these problems together.
Just about a minute left here, but what about Canadians themselves? We saw a lot of support and recognition for healthcare workers during the onset of this pandemic. So would something like that maybe help the morale right now?
I think appreciation and gratitude always goes a long way to make people feel valued. And the vast majority of Canadians have been incredible that way in terms of supporting healthcare workers. I think what people can do now is really let their elected officials know that they want to see governments commit to working with us and to actually getting on with solutions. And each of us has a vote. Each of us can go to the people that represent us and demand that this is a priority.
Dr. Smart, thank you again for joining us today on Forum Daily.
Thanks so much for having me.